Excellencies, ministers, PPD officials, colleagues, distinguished panelists, participants, ladies and gentlemen, Assalamu alaikum and greetings from Pakistan. It is an immense pleasure for me to have the privilege of delivering the closing remarks of the 17th Inter-Ministerial Conference on South-South Cooperation in Population and Development, which was titled The Nairobi Commitments and the 2030 Agenda, Taking Stock and Looking Ahead to the Post-COVID-19 Crisis. At the very outset, I would like to thank partners in population development, United Population the United Nations Population Fund, UNFPA, the National Health Commission of the Government of China for organizing this very important conference at this crucial and critical juncture of human history, when we are fighting the deadliest pandemic of our lifetimes. As we know that the international community assembled in Nairobi in a global summit on ICPD at its 25th anniversary in November 2019, and discoursed on achievements and imperatives of ICPD and expressed a wide range of commitments and concluded with a set of targets to achieve them by 2030. The most important of them were three zeros: zero unmet need for family planning, zero preventable maternal death, and zero gender-based violence and harmful practices. While the countries were contemplating integration of these into their national development agenda, the deadliest pandemic of this century struck the world and forced nations to engage their human and material resources to combat this pandemic. The initial effect of this unknown and lethal disease and the eventual deaths that traumatized and confused the nations, but eventually the fast and decisive actions and turnaround from across the world put the pandemic on the spot. And while there is a second wave in many countries, the countries as a large have been able to combat this, but are now faced with the additional challenge of the new wave in many countries. Excellencies, ministers, PPD officials, colleagues, distinguished panelists, and participants, in Pakistan, we had, like many countries, limited preparedness for this unknown disease at the initial stage. But our multi-pronged approach to combat this in a coordinated manner and the optimum use of science and technology was able to get us to a situation where we were able to tackle this pandemic and slow it down. While initially we had shortages of even protective equipment, but eventually the response and strategic campaign within the country of making sure that we were able to come up to the required needs bore out, and we were able to indigenously produce many of these things ourselves. And of course, we also were able to bring down the disease while at the same time balancing the need between lives and livelihoods, and to therefore also ensure that no one was left behind in receiving the products and treatments that were required. We followed a strategy of smart and targeted lockdowns for this purpose, in addition to many other technical innovations that were evolved while the epidemic raged. Like many other countries, we had to pull resources from other sectors as the fiscal budget did not allow for allocations for this unforeseen danger. It is not easy to fight such a disease without having specific vaccines and therapeutics, but collectively, the world and within Pakistan, we were able to effectively tackle the menace by repurposing existing technologies and capabilities. And while we still tackle the second wave within Pakistan and many other countries, the encouraging bit is that all over the globe, the commitment and efforts have not ceased to implement not just the effort in containing coronavirus infections, but also in trying to implement our commitments to family planning, reproductive health, and population programs. Excellencies, I'm very happy, and I do believe my colleagues and with my partners and our partners that this conference is timely and is appropriately organized to ensure that we find effective solutions on how we will advance our population and development programs while keeping the current pandemic in mind, in perspective. In the past, we have experienced epidemics and controlled them with vaccines and therapeutics. But as we are today, we require not only the efforts against this pandemic, but our routine healthcare structures and delivery mechanisms in place as well. We really do not know how long we will have to uh, tackle and battle the present challenge, but perhaps forthcoming vaccines will allow us to proceed further a little bit easier. But how in this pans out remains to be seen. We definitely have to think seriously of marching forward and working alongside, living with the pandemic for some time. Once we are triumphant, we will be able to uh, focus better and directed efforts towards many other pressing needs that we do have. We will also have to remain vigilant and put necessary preparedness for future and other pandemics. Ladies and gentlemen, the sequence and evolution of this organization, of this conference, has remained uh, praiseworthy and wonderful. Two insightful sessions addressed by the world's most acclaimed population and development experts were followed by this current ministerial session. The most salient features of this precise, innovative, and practical solutions that came out emerged from two sessions that were reflected in the call for action that we have just adopted. Excellencies and ministers, today the ministerial session on promoting South-South cooperation for attaining the Nairobi Commitments and the Agenda 2030 has provided insightful thoughts and profoundly incisive discourses by the leadership of our governing board, the chair, the vice chair, the secretary and treasurer, including other ministers, executive committee members, and board members. I would like to thank the UNFPA Executive Director, Dr. Kanem, for making a thought-provoking keynote address and expressing the UNFPA's willingness for continued partnership with PPD. The leaders and ministers have invariably emphasized the importance of strengthening this South-South cooperation while providing remarkable visionary guidance of the design, development, and implementation of exceedingly increasing program activities in the member countries within the framework of the South-South cooperation. The invaluable guidance has also been incorporated into the call for action that we have just adopted. The document would be further improved, incorporating some of the new elements that have emerged from the deliberations that we have witnessed. Excellencies and colleagues, we have accorded legitimacy to this inspiring call for action by adoption in consensus to reap the benefits of its implementation, to which we have already committed ourselves. And the document contains the Nairobi Summit commitments, the 3 zeros, and the 2030 agenda. We urge all our countries to integrate important elements of the documents into our long-term national development agenda, which will automatically trickle down to formulation of annual policies, design, development, and implementation of relevant program activities, and thus creating a lasting impact into the lives of our populations. While some of our member countries are well endowed with technical capabilities in articulating coherent strategic vision and functional sustainable policies, other countries will require some assistance. That is exactly where South-South cooperation plays a key role, as the interlocutor amongst the countries for sharing, exchanging, and transfer of knowledge, expertise, and technologies. We would also like the countries to make necessary investments for implementation of the activities contained in the document. Quite naturally, countries will have to allocate resources in the next or coming fiscal budgets for the prevention and treatment of COVID-19. And a significant amount of resources would be required for the procurement of vaccines as they become available. Indeed, countries need to seriously pursue science and technology, not only to purchase and source these vaccines, but to also think of local development of many of these technologies. Since many, in fact, 80% of the world population live in developing countries, and countries like China and India house more than 1/3 of the world's population. Therefore, it's natural that South-South cooperation would be a comprehensive paradigm of development solutions once it encompasses all our walks of life. We in Pakistan believe that our organization, this organization, will gradually evolve to the stage to do justice to its name With these words, I conclude my closing remarks and thank you all for your patient attention.